Welcome to another program in our series of the DFL Senior Roundtable. It's my delight to have with me today Jim Reed, the DFL Senior Caucus Secretary. Welcome, Jim.
Welcome, Bill.
And I'm looking forward to hearing your remarks on the DFL Senior Caucus.
Okay. Bill invited me to come today to talk about the Senior Caucus and particularly why we exist and why it is a benefit to you, the person, any person actually over 50, but even their children and grandchildren, when you consider the properties of our nation and the questions that now are posed by an older demographic. Let me go back to a little bit about how the Senior Caucus formed, which was in 2006, this year being our 10th anniversary, and one of which we've been at events celebrating that anniversary. Linda Feist was the person who originated this version of the Senior Caucus. There had been a prior Senior Caucus in the DFL, but that particular version eventually ended, probably because, well, frankly, there weren't as many seniors in the populace then as there are now and will be. And in fact, the numbers of seniors in the populace will soon be greater than the number of children through the age of 20 because so many baby boomers will be retiring over the next 10 years that the senior populace will grow by a fair magnitude. Linda and several others, Dwayne King, Earl Bauer, and political novices like myself, started the Senior Caucus because we could see that this change in demographics was going to pose significant problems to our country and particularly to our public institutions, because nothing had been done up to that point really to address that question. What kind of society, what kind of nation, what kind of governance do we need for a country that has become more senior than junior? So the Senior Caucus was put together to try to get our public officials as well as our general society to recognize the issues that are upcoming due to that aging of our society and to make the proper steps to prepare for that. Unfortunately, in Minnesota in 2006, we had a Republican governor, Governor Pawlenty, who was at best antagonistic to questions with reference to seniors and viewed, as many in the Republican Party did and still do, that those over 55 are draining away resources that could be better spent for other individuals. But in their case, what they meant was other individuals who happen to be rich. Our view was that unless we develop a society, a culture, and a governance that fits with the demographic that we were facing, we would all be poor. And in fact, one of the key propositions of the Senior Caucus is that unless we address those problems for those who were 55 then, 65 now, and even 55 now, then those younger will suffer because they will be responsible for taking care of their parents and grandparents. In fact, 85% of all care for parents and grandparents is provided through their family members. And that is all done without or with little, if any, support from the society around them and the government and local institutions that could, but unfortunately were not prepared to provide much support. So we put together the Senior Caucus with the purposes that I'll now read because they pretty much define why we exist and why it is a benefit for those who agree with our principles to be involved. Our first and probably foremost is to foster the involvement of seniors in the political process. Now, we do know that seniors vote, and they tend to vote at a higher percentage than earlier, younger groups. But unfortunately, they have had the characteristic of voting against their best interests and also the interests of society. The Senior Caucus was put together to see that we would make some change in how that voting by seniors had occurred, a voting that had put Pawlenty into office and would in fact re-elect him in 2006. But by 2008, we had seen some change when in Minnesota, seniors voted more for Barack Obama than they did for his opponent. So our first and most important was to get seniors, get those who would be most affected by the changes in our society and the lack of vision by our government with respect to that, to be involved. Our second purpose was to encourage active participation in the DFL. Too many of us simply don't get involved, and they need to be involved. And they need to be involved in ensuring that our Democratic Farmer Labor Party recognizes in their elected officials and staff that seniors vote, that seniors have issues, and that these issues really affect all of us. Third was to bring outreach and focus to senior issues. And certainly I've talked already quite a bit about that. But I think it is probably our most important, beyond just bringing seniors into the party itself, our most important activity. Four, to promote, support, and hold accountable DFL candidates who are aware and committed to the concerns of Minnesota seniors. Well, that really is where we spend a lot of our day-to-day effort, and we do have a Day on the Hill event where we bring to our Minnesota legislators the concerns that we have learned by asking our membership. So we do surveys. Every year we do a survey at the state fair, and we do other kinds of like activities to know what our seniors fear, what our seniors need, and most importantly, what our seniors enjoy. To go on, number 5, increase the voter turnout among seniors. Well, actually, seniors do vote quite well, and we've even worked with groups to help promote not only voting of seniors, but also voting of younger generations, because overall, democracy will fail in this country and around the world if people do not vote. But mostly, we were looking to see that those seniors who had difficulty voting, particularly those who need absentee ballots or other forms by which they could make their voice known, had the opportunity to do so. When the Republican Party tried very hard to put in voter ID, we were most active in ensuring that those seniors who would be denied the right to vote would in fact maintain that right to vote. So we saw that as a very important process to be involved, and we put in quite a bit of effort in 2012 to see that voter ID failed in Minnesota, where it has unfortunately succeeded among other parts of the country where the Republicans have had a chance to put it on a ballot. We're very proud that we rejected voter ID. Finally, number 6, to ensure appropriate senior representation in the party, including, where we can, those that want to run for public office. The Senior Caucus does endorse candidates, particularly senior candidates, who are running for office and who, when they come talk to us, make us feel happy that they will be or can be elected because they will support us. And they agree with some of the issues and concerns and solutions that we agree with. So that's why the Senior Caucus was formed, and the Senior Caucus continues to be active in particularly those issues that are most concerned with seniors. Each election cycle, we go through the effort of developing resolutions for the DFL party that they can put it in the Minnesota Constitution where it matters, and in the set of principles that the DFL follows, including the action items that we hope our DFL representatives will enact in the legislature. So every election cycle we go through that. We have been involved when we have major political events such as the election of Governor Dayton. Prior to that, we, as well as other caucuses, jointly interviewed the candidates on the DFL for the office of governor and wrote up for our membership not only a brief outline of the questions and answers to the DFL candidates, but also what we believed was the gist of what they were saying. So we were involved in and continue to be involved in the election of candidates. We have a Seniors Calling Seniors program by which seniors go out and make telephone calls to other seniors promoting the DFL principles, promoting DFL candidates, and particularly promoting their involvement in seeing that senior issues get senior solutions. So we stay active, and we are active, and we need members who can be active. Now, one of the things that we did starting in 2008 was to promote the idea of chapters, of which Bill here is forming a chapter for the Northwest metro area. Our first chapter was actually in Rochester, Minnesota. And that chapter formed because Rochester had fortunately changed over to having U.S. representation by Representative Waltz, a Democrat. But locally, Rochester was a relatively conservative community that had a set of problems facing their seniors that the community was not necessarily addressing. As I said before, overall, our country has failed to address the issues of seniors. And in fact, Republicans have called for cutting back on programs like Social Security, on which so many seniors depend. We formed these chapters because we believe that only by having local participation could we see the Senior Caucus grow, and could indeed we see the Senior Caucus and seniors in general have influence within their communities, particularly in greater Minnesota. So Rochester was first. Second was Brainerd. We formed a chapter in Brainerd. Obviously, two communities, Brainerd being somewhat smaller than Rochester, that were of significant influence in the rural areas of Minnesota surrounding them. We have since had chapters in the metro area because, frankly, particularly the suburban parts of the metro area also need representation in the issues of DFLers, the DFL party, brought in focus to the seniors living there. So we have an extremely active chapter just across the Minnesota River in those suburban communities, Burnsville, Apple Valley, Eagan, and the like, that had unfortunately gone Republican after the death of their representative, but may this year go back to being a Democratic representative. They are very active. They have upwards of 150 members, of which 75 to 80 attend their meetings. This is the kind of effort that we feel we need to be able to have seniors get the governance that they need in their local areas. And without that, even if we have success at the Minnesota legislative level, local levels will simply not do the kinds of actions necessary to make life for seniors and life for the rest of the community be better, more engaged, more desirable. So that's why we're here. And that's why we have chapters. We have several more chapters since those three. We have a chapter in Anoka, which I'm involved. We have chapters in other parts of rural Minnesota, including Moorhead, which to me seems a long ways away. We are working to develop chapters in western Minnesota, but it's somewhat difficult there because, frankly, the population density is low and it tends to be a rather conservative part of the state. We hope soon to have a chapter in Duluth because our ex-lieutenant governor has said that she would like to be the chapter chair. But things go slowly, particularly when we are running into an election season as this one, where decisions at the national level seem so stark, and the opposing party seems to have truly gone off the rails. So we are working to see that these will be resolved in hopefully a beneficial manner. We will continue to be involved with our state legislators in their elections and being at their Day of the Hill, making sure that they understand what issues we have. We will continue to work with state legislators such as Scott Dibble, the chair of the Senate Transportation Committee, to have them understand that seniors in greater Minnesota who may have found their community hospital closed need the kind of specialized transit services by which they can get to the clinic and hospital or family and friends they've been unable to do because they need to travel more than just in their local community. We continue to work with Senator Klobuchar on the question of drug costs because, frankly, since President Bush passed the not so desirable and, in fact, plain gift to the pharmaceutical industry of Medicare Part D, seniors have seen increasing drug costs with such drugs such as insulin, which many seniors need because they have developed type 2 diabetes, have an upwards of 4-fold increase in the last 10 years. And we work to see that seniors, as Governor Dayton once proposed, have the opportunity to import from Canada when drug importation works. And we have worked with individuals at the supporting Senator Klobuchar and Representative Ellison's efforts to see that safe, reliable, and cost-effective drug importation is provided, and it is in the Democratic platform for this year. We work to see that communities do develop the kind of services that seniors need to be able to stay in their homes. Staying in their homes tends to be one of our principal efforts because, frankly, seniors want to be there, seniors are comfortable being there, seniors can be effective being there, and in fact, seniors can live without and enjoy their lives with their families without having to be a financial or physical burden. So we do all these things, and we really need people to be involved not only nationally and statewide, but locally in seeing that those issues and solutions progressed. So I ask you, who may be listening, to join a Senior Caucus chapter, to work hard to see that, in fact, the questions that you have and the questions that your neighbors have, not only with respect to themselves, but with their children and grandchildren, can be approached, can be reviewed, and can be solved. That's why we're here. Thanks.
Thank you. That's what an excellent review of the Senior Caucus and its what it's accomplishing, real benefits for everyone. And I understand that the Senior Caucus has taken positions on a number of issues. One you've spoken of is the sound transportation systems. Is there anything further on that?
Yeah, well, it turns out that there is, in fact, federal and state money by which communities have been able to establish local door-to-door transportation services to members of their community. The problem is that, with the exception of perhaps the metro area where we have metro transit, most of these local community services end at the boundary of the community. There might be occasionally a county service, but by and large, the services have a range of 20 miles. But what with the drop-off in community hospitals, as we know within medicine, there's always been a considerable drive to reorganize the medical system so that it is much more based on large hospital services rather than community hospitals. Well, seniors may have to travel more than 20 miles to get help. And on top of that, their families, their friends, their neighbors may no longer be within that 20-mile radius. So our idea was to work with Senator Dibble to provide some means by which these services could be coordinated so that rather than having to go, as we would today, to linkage line, and they would give you a list of local community services to call so you could patch together perhaps a travel from Mankato to Moorhead. That instead would be there for you because the community services themselves would be interconnected through some sort of network which they then could schedule your ride. And hopefully not have to make you get out of a car, onto a bus, off a bus, into, I don't know, some sort of other vehicle, maybe catch a train or whatever to get to where you want to go. That's what we're trying to do. The problem is that because the funding has been so diverse and from so many different directions, it's hard to get the funders to put the money where it belongs, which is a coordinated service across the state. Good.
And I understand some have spoken of supporting the senator's bill that would provide single payer. That would save a great deal, would it not, in costs of the negotiations between providers and insurance companies? What do you think of that?
Well, there's no question that the Minnesota health plan has been proposed would likely provide a more efficient, more cost-effective, and more available health service. The issue right now is really to do a study by which it can be demonstrated that, in fact, a universal health care plan would be more cost-effective than the private and rather adverse, complicated system of healthcare we have today with its various kinds of insurance programs as well as a Medicare program that is only partly Medicare and partly private. And of course Plan Part D, which really just gives the insurance companies as well as the pharmaceutical companies a significant subsidy in order to give anybody in the country who is senior the medications they need. And anyway, we have certainly been a supporter of that plan and the Minnesota Health Plan, and have put that every election cycle on our resolutions. But there is, as the legislature now stands, considerable opposition to its progress. But hopefully in 2017, then at least we'll do the study and finance the study by which we can compare how efficient that plan would be versus what we have today.
Good. So we may be able to make progress if a DFL majority is elected to the House.
Yeah, absolutely. And pretty much we understand that the Democratic Party believes that they really only have to turn 6 House districts in order to get back control of the House. Of course, politics is politics, and who would have ever guessed that we would have a 5 times bankrupt candidate on the national level running for the Republican Party. But there we have it.
Yes, it is strange times. One of the other issues the Senior Caucus has addressed is affordable housing. Do you have a comment on that?
Well, right. We probably have seen not as much progress in affordable housing as we would like. We recognize that in certain areas of the state, housing can be almost beyond the reach of seniors. One of the interesting studies was done by, I believe, Columbia University, that found within rural Minnesota that particularly senior women were living primarily on Social Security and an income of about $12,500 a year against expenses, including housing, that were in the order of $17,000 a year. In other words, what savings they may have had was being consumed at a rate of about $5,000 a year, which would mean that unless they were lucky enough to have a significant savings account or some other financial support, perhaps by their children, again, pointing out that in the end the children will pay, frankly, they were really in tough straits. Affordable housing is one of those tough straits that in some communities we have seen some success. Here, actually on the border of Maple Grove, it turns out that there has been some progress, and even though Maple Grove, having a fairly conservative city hall, has been willing to provide some housing which is in the affordable range for those seniors who need such housing. But that isn't true across the state, and it is much more difficult in areas that have been traditionally conservative and usually in greater Minnesota.
Jim, we have less than half a minute left, so.
Well, I can talk a lot, as it turns out.
Shall we plan to do another half hour?
I can continue talking now if you want me to. Or
Okay.
What do you mean?
Good. We do have provision for that. So let's continue. Is there something more on affordable housing, or do you want to talk about one of the other issues, the safe and livable communities?
Well, yeah, that is an interesting question, because we know that during the